Artlines. And I'm going to show you how to put one in. But first off, what are the indications? So somebody raise a hand. Yeah.
Continuous monitoring of blood pressure.
Okay, continuous monitoring of blood pressure. Raven.
Frequent ABG.
Frequent ABG draws. That's it.
Oh, isn't the patient's hemodynamically unstable?
That would be because we need to do continuous blood pressure monitoring.
Mm-hmm.
So kind of along the same lines. So patients are very hypotensive. Can you unlock that? Is it? I thought it was. Okay.
I heard it too.
Patients are very hypotensive. We want to monitor their blood pressure continuously. We put in an Artline. Someone who needs frequent ABG draws, we put in an Artline. Patients, when they come out of surgery from like open heart or a cabbage, they'll have Artlines in, things like that. So, what's a contraindication? G.
My apologies. Can I just?
Yes, you can. No pulse. Fabulous. The patient doesn't have a pulse. Let's not put in the Artline. J. Contraindication. Infection in the site. Like there's an infection here. Yes, that would be another one. Casey.
Failed Allen's test?
Yes, failed Allen's test. Alan.
Infection.
We already said infection. What's another contraindication?
Here's your binder, Alan.
Yeah,
Somebody give him a slick.
trauma to the side.
Trauma to the site.
You got coagulant. I can't say it. I'm a German. I really can't pronounce it.
Coagulation problems.
Yeah.
What does that mean?
Blood.
Their blood won't clot. Yeah, we're not going to stick an Artline in somebody if their blood won't clot because they'll be bleeding forever. There's another big one I'm missing. Yes.
Raynaud's?
Yes. What is Raynaud's?
Isn't that where you have like insufficient blood flow to your
Poor circulation. They're always very, very cold and blue. Same type of patients you can't get a pulse ox on their extremities. So we get them up here. Yep. All right. What's the complication, Nick?
Big complication.
Like to putting in an Artline, what can happen? What's a complication that could happen?
Well, you don't find it.
Okay, that might be technique.
Infection.
Yes, infection again. Daniel?
artery damage?
Artery damage. What else? Hematoma.
Could be removed.
You could totally ruin the artery.
Nerve injury.
Yeah. Infection is the number one thing, Kevin.
I was going to say compromised blood flow.
Yeah, compromised blood flow. True story, because you know I always tell true stories. Guy didn't do an Allen's test on his patient. Yeah. How many people see Allen's test being done in the hospital?
Haven't seen one.
On the
Haven't
checklist?
seen one. I did
Oh,
one.
it's on the checklist, so they check that they did it?
Yeah, this is exactly. I've seen it like twice, you know, in real life, but.
Compromise what?
Blood flow.
My instructor said, we should, but we don't. But he showed me and did it and said this is what we should in the hospital wants us to do.
And why don't we do it?
Time in.
Time? Oh, excuse me, sir. Can you put a fist? Can you make a
Look,
fist?
you could already have the line in.
Okay. Wow. It's kind of like pushing that 100% O2 button before you suction. Lazy RTs that don't do it. Yes.
Well, if you can feel it right away, I mean, like, is there reason to have to do it? Like, if you can feel the artery, like,
Why do you do that test?
to make sure that it's on both sides, right?
Collateral circulation.
So if you only fill your artery, are you checking collateral? Or are you
Well,
checking-
no, I mean, but like, I'm talking about if you're
So what? I
checking
can feel my artery. It's still there. Doesn't mean it's giving blood flow.
No.
No. No. Not but. No. Just a plain old no. Huh? Collateral circulation. So this guy did he did an Artline, or it might have been even an ABG. Didn't do the Allen's test. He severed the artery. Guess what? The patient did not have collateral circulation. And guess what happened?
Lost an arm.
They did. Seriously, lost his arm. Guess who got sued and lost his license? To RT. Seriously, you guys, it's so stupid to not do an Allen's test. Especially, oh, that's even better, Jeremy. Especially, let me tell you what's going to happen if you check yes and you didn't do it and the patient loses an arm.
Lied.
You just lied. What's going to happen to you in court? They're going to eat you alive. I've been to a court for something that happened, and I'll tell you about it later. And the nurses were caught lying. And it's part of why a patient died. A 12-year-old on a ventilator at home. Because they were documenting that they did something that they didn't do. It turns out they were just writing down what the person before them wrote. One of the alarms wasn't on, it didn't go off. The patient became disconnected from the vent and he died. Came out during the trial, because the company I worked for, we weren't going to settle because they were trying to say it was our therapists that we were negligent and didn't teach the family how to do things. And so we went to trial. And during the trial, those nurses got caught lying on the stand, and we won. It has a jury and everything, and they found us not responsible. Those nurses were held responsible. I'm sure were sued by the family, and they definitely did lose their license. So it's serious. Don't mess around, you guys. Simple little shortcuts that you don't do seem like nothing, but they could turn out to be a really big deal. So do your Allen's test, okay? All right, so that's the main things for that. So let's talk about the supplies that we need, all right? So we need a pressure bag. We need a bag of saline. We use different things here just because of what we have. Sometimes, ooh, that one's even got some good stuff in it, some floaties. Woo! Heparin or saline, and we're gonna have a transducer kit. So there's a couple different kind of transducers, and apparently one of the ones I had broke, but I will get another one so I can show you, because we have transducers that have what is called a vamp and transducers that don't have a vamp. When you draw from your Artline, has anybody drawn from an Artline yet? Yeah, a couple of you? What do you have to do before you can actually take the arterial sample? Waste. So some transducer lines like this one, we're going to pull the waste off with a syringe. Some transducer lines have what is called a vamp, and the vamp is basically like a little container for the waste blood. So instead of me using a syringe, I would use the vamp to pull back. The blood would be held in there, and then I would push it back in there. So instead of using a syringe and throwing the blood away, you just do it that way. So that's the big difference. Transducer kit right out of the box, which is what you guys would have. It looks just like this. So we're not going to open these right now because we have plenty that are already open, but I just want you to know it's no different. So the transducer is going to hook into the IV bag. It'll have a little blue or green tab on here, plastic. You pull that off and then you just spike it and you put it in. And then we're going to hang it. When you guys do your Artlines, you will do everything except spike the bag because our bag is already spiked. We're not going to undo them. This is the actual transducer itself. Does anyone know what the transducer does? What's the purpose?
Pressure sensor.
It's what?
A pressure sensor.
So what does it do? So what does it do to the pressure? Why is a transducer here?
It monitors the pressure from the artery, and then that's the actual sensor part that sends a signal to the machine.
Perfect, yes. So the transducer takes the pressure and converts it to a waveform on the monitor. So if I was in the ICU, this would be hooked to a cord that would be hooked to the monitor. And then you can get your automatic blood pressure reading. That typically just looks like this. And it has what we call a dichrotic notch. That tells us that it's functioning well. That's how we want it to look, or something close to that. So you gotta have the transducer. This is used to flush the line, our little pigtail here. You can either pull on it or you can squeeze it like this. And I'm gonna actually show it when I hook it up, because the nice thing about these arms is everything works. And then we have a couple of stop cocks along the way, and I'm gonna show you how those work. There's one here, there's one here, and there's gonna be one on our bag, okay? So we have that. Of course, we have our patient. There's our patient. I'm going to have my Artline kit. For our purposes here, we don't use the needle that comes in the kit because it's big. We use one size smaller. So for us here, you're just gonna get a pink little 20 gauge needle. Normally you would use the needle that comes in your kit. Our kits have what is called over the wire technique. It's not complicated, but it's the more complicated of the procedures with Artlines. Some of them you just stick the catheter in with a needle and then hook it up. So we're gonna do this. This is called the Seldinger technique, Seldinger. Any technique that uses a wire over the wire is called a Seldinger technique. So if I put in a CVP line with a guide wire, it's Seldinger. It's just the person who invented it's using a guide wire to place a catheter into our patients. This one also has a long catheter in it than some of the kits. The longer ones are actually more stable. They stay in the patient better and not have less risk of becoming dislodged. So that just happens to be the ones that we have here. And then we're gonna have fenestrated and non-fenestrated drapes. So non-fenestrated, the boxes say N and F on them, we marked them. And then a fenestrated has a hole. Non-fenestrated doesn't. And we're gonna have a chlorhexidine ring, which we're gonna put on there to help prevent infection. They'll be in these little packs until they've all been opened, and then we'll just put them into our sterile pack that we're gonna be using. So today when I do this, I'm gonna be opening up this kit for the first time. After we open up kits, we reuse them in these self-seal pouches so that every time you practice, you can practice opening up sterile, because that's part of the technique people have to get, is keeping everything sterile. So if you were using this pack instead, we could put a chlorhexidine ring in here. And when you open sterile, just to show you how I would do this one, you would open, like they pull it from here. You're not, see this end is sealed. So we're gonna pull from this end up here. And then I would pull away. And a lot of people too, your idea is you're gonna wanna dump it onto your sterile field. So I'll show you that when we get to that point. Then from a PPE, sterile, chlorhexidine. Don't open this, but it's gonna be pretend chlorhexidine that we're gonna use to clean our patient with. Then I'm ready to start my procedure. Of course, we have our doctor's order. We're gonna come in and you're gonna put a mask on with a shield ideally, but we're out. So I'm just gonna use this one for today. I'm already, just so you know, everybody's gonna be hot while you're doing this, so be prepared. Ladies, all your hair has to be up. Men has to be up in this cap. And if it was Miss Cody, she'd say no curly cues. They all have headbands on, so we're just gonna go for the beautiful look here. Ta-da! So that's what you do when you go in till you see your patient. You're getting ready to do the Artline. And no jewelry, nothing below. If you have tattoos, that's fine. You'll be allowed to show them for this part because you'll have to have your jackets off. Nothing is technically supposed to be from here down because that's part of being sterile, okay? Next week, Miss Lewick is gonna come in, the surge tech instructor, and she's gonna show you how to do what we call closed glove sterile technique. That's with a gown on, what they showed you guys in presentations. I'm going to do open glove technique for the Artline. I talked this whole time. So, minimum requirements per CDC guidelines for sterile for Artlines is sterile gloves. Of course, we're gonna have our sterile drapes, mask, and cap. That's minimum requirements. A lot of hospitals have you do full sterile for Artlines, some don't. So for our class, we're gonna do the open glove technique, which is not with a gown on for Artlines. When later on in the term, at your final, you're gonna do a checkoff with closed glove technique where you have to wear the gowns and everything. And you will be practicing starting next week. Trust me, it takes a long time to practice. Sterile technique is the hardest part of this, making sure that you maintain your sterile areas. So, and I'm not gonna put my sterile gloves on yet, okay? So, first thing I'm gonna do is check my patient for their Allen's test. So we said their Allen's test is good. Then I'm gonna take my chlorhexidine, and typically you would have 3 little, not Q-tips, but big kind of Q-tips with chlorhexidine on them. And what you do is you're gonna do a circle motion in the area where you're gonna insert the Artline, and you never go back in to your area. So when you're circling, you're gonna circle and you go out for 10 seconds. Then you would get the next one, circle more and go out for 10 seconds, never back in. then get the third one and do another circle for another 10 seconds. So basically 3 of those is what you're doing. Then we're gonna let that dry. That's why we do that part first, so that can dry. So that's done. While that's drying, we're gonna get our transducer and our bag ready. So we have, take this, put it in the pressure bag. Like so. Some of them have a little blue hook here, some of them don't. You can just take your little string, put it through there because you don't want your bag to fall through. Don't put a 1,000 milliliter bag in a 500 pressure bag. It'll explode because it's too big. Now what you're gonna do is you're gonna pressurize this up to 300. So we have another first stopcock that you're gonna come to is right here. So what you wanna keep in mind with these is right here it says off and an arrow. So this right now would mean off to this port. This means off to there. I can't pump anything because I just said don't put anything here. And so it's actually coming out this way and you can hear it. And your bag's not gonna pump up. Get a little air. And if you put it down this way, then I'm blocking this off. It's not gonna do anything at all. So I want the port to be off to this because I don't want air going out here. I want air to be able to flow straight through. So when you think about how this is, think about what do you want going straight through. And there's actually little holes in there that you can see if you look at it. So the holes need to be the direction that you want the blood, the fluid, the air to go. Where the arrow is where it's gonna be blocked off to, okay? So now we'll be able to pump this up. And it even sounds different once you get used to doing it. Eat your Wheaties for this part. You're gonna watch this little pressure gauge here. It's gonna go to 150 and then you're gonna see the green and it'll be at 300. I told you. Once it's, the middle part takes a little longer. Once it's almost there, the last part goes quickly.
So are you looking at that middle thing?
Yeah, right here. See where the green? Once you see the green, it's at 300. So now I'm gonna take this, and which way do I want it to go? Towards the bag, because you don't want the pressure to come back out, right? Right. So now I'm gonna take this and I'm gonna close this off so that none of my pressure comes back out. So this is saying this is off, that means nothing can come out that way. If you don't close it, you will lose some of your pressure over time, okay? So we've done that. Somebody get me a styrofoam cup from the back counter, please. Or is that cup still sitting there, Perry? Okay, thank you. Next thing you have to do is flush your line, but we don't want air bubbles in it. A little tiny air bubble is not gonna kill your